Okay, so we're going to be doing medication administration through an NG tube. So the first thing I would want to do is check my physician's order to make sure the medication was correct. And we'll say that that medication order was for 325 milligrams of acetaminophen, PRN, mixed with 15 milliliters of solution, just warm, like room temperature water. So I would want to check that order with my MAR, make sure that it looks correct, and if it was correct, I'd proceed with the procedure. I want to do some hand hygiene and don some gloves. And I would have an unopened, sterile syringe over here for mixing the water with. I'd get a cup, fresh medication cup, and I'd unlock my cabinet, come in here and get the right medication. I would note the right amount and everything. I'm going to open it into the cup, and since acetaminophen can be crushed, that is you have to crush the medications for the NG tube because you can't get a pill down that. So I put it in this little baggie. Crush it real good. These are really thick pills. Okay, I think I got it. So I'm gonna open this up a little bit. Pour it into my cup. And I would draw 15 milliliters of fresh water. I would just put that in there, mix it up, make sure it's dissolved. I draw the medication back up into the syringe. Should yield about 15. Now we get rid of that cup. So then I would bring this over to the patient's room. Knock, knock. Hello. My name's Aaron. I'm a student nurse. I got a order to give you a medication of acetaminophen through your NG tube. Is that okay? I would want to make sure that it's the right patient, right medication, and make sure that this is unhooked from suctioning. The first thing I want to do with NG tubes is check for placement. And the way I'm going to do that is grab a syringe that I've already had set up in here, and you want to do just, I don't know, about 10-15 milliliters of air into the tube. I want to make sure that I get down here at the stomach. We're just listening for air bubbles. Unhook this, get this set up, and I would listen for the bubbles, and we did hear them. So it's in the right location still. So I'd unhook this, put it over here, this here. I have the head of the bed elevated already. The only other thing I could do really is maybe pull the bed up so it's easier for me, but it's pretty much the same. So before you administer medications through an NG tube, you want to draw up about 30 milliliters of water, so you can do 15 before and 15 after to flush the tube. And as I'm doing this, I would make note of how much I'm putting into the patient. That way I can document it on intake and output later through the NG tube. So I just put in 15 milliliters there. Set this back in here. Next thing I would do is administer the medication slowly. Okay, take that off. And then I would have my 15 milliliters of water already drawn up still. And insert that. Oh, we've gone slower than that, that's a little fast. Anyway, so I would hook it back up because you can't put it to suction for another 30 to 45 minutes to give the medication time to absorb. So I would leave this here and make sure the patient didn't need anything else, lower back to the bed and clean up my area, and that is giving a medication through the NG tube.